So Dr. Susan Cordes is in private practice in Northern California. Prior to this, she was an academic otolaryngologist and is currently a volunteer professor at Indiana University School of Medicine. During her academic tenure, she became involved in the Indiana University Kenya AMPATH program and has led surgical teams to Kenya annually since 2009. She's an honorary lecturer at Moi University in Eldoret, Kenya, and she has served as the chair of the Humanitarian Efforts Committee of the American Academy of Otolaryngology and really remains active within this community. She gives lectures on the topics of humanitarian otolaryngology and has been a recipient of the AAO Distinguished Award for Humanitarian Efforts. Today, given our international audience, she'll be speaking to us on establishing research and educational collaborations internationally. Thank you, Dr. Cordes.
Thank you, Galen. Go ahead. Well, thank you very much for being a part of this panel. This is an amazing set of talks to follow, and I hope I can even begin to be up to par for this. And again, thank you for letting me be a part of this. Most of this is from my personal experience and from networking with other people who do this kind of work, but also drawn from the literature as well. Let's see if I can advance here. I have no disclosures. I think that probably the most common thing that I hear from residents and young physicians is they are struggling with trying to find the right venue to do global work, usually in a low resource setting. And that can be the initial hurdle. But I think even before you take that step, you need to do perhaps a little soul searching. And so Julie just gave this great talk about, meditation and introspection. And I think when it comes to global work, that's really important because you have to really know what your goals are. It's very different to be going because you really wanted to see a certain part of the world or see a different part of the world every year and do something different versus thinking more about the recipients of your skills and of your knowledge and what you have to offer. And it's a huge commitment to embark on humanitarian work, and specifically when it comes to research and to education. Going to one place one time may not be very useful. I mean, it's better than nothing, but I think we all know we can do better than nothing. And you don't, when you're training a resident, you don't tell somebody one time how you want them to care for that patient and expect they'll remember it forever. And it's the same thing when you do teaching overseas. It's that reinforcement. And like Carol said, 7 times, 7 ways, it certainly applies in this situation. You also have to be really honest with yourself about what your comfort level is, both physically as well as in the operating room. It's not going to be the air conditioning. The hours can be very long and challenging. But going back to Julie's talk too, you also have to put some limitations because the amount of work to do is literally infinite. So you also have to think about your own personal health, like what limitations you may have physically or medications, that sort of thing. Also, it's important to assess your financial support. Will you get support from your academic department? Is this all going to be funded yourself? Because it is very expensive and it definitely adds up over the years, as my husband will definitely attest to because he manages our finances. But you'll need time off, a week or two, a year, or a couple times a year really adds up as well. And you have to have the support of whether it's your academic department or if you're in private practice like I am, is your group going to cover for you and be supportive of that. And then maybe most importantly, your family, your spouse, taking time off, using some of your vacation time. Are they going to go with you, or are they going to stay home and you're going to be absent and not be a part of this experience? Those are important things to ask yourself. And then also, if you do plan to have residents or other team members, appropriate supervision and mentorship during these challenging efforts. So getting started, resource, probably number one would be the Academy. And I have some websites here for the Academy, for the International Federation of Otolaryngology Societies, American College of Surgeons. But the academy, I would say, is number one. For one thing, it's all otolaryngologists. It's all national, and there are such robust humanitarian efforts and so many people that you can network with, both at the academy meeting, but also outside the academy meeting, can establish relationships. But also local colleagues, other physicians that you work with in your community. So you have to really sometimes think a little bit outside of the box. A little bit of my advice, I'd say, on education is number one, you also have to be very well prepared. You have some idea of what the needs are of your host, and it really helps to get input from them prior to the trip and say, what are the areas that you really want us to focus on? What kind of things do you want us to talk about and to practice while we're there? And then be prepared, whether it's with PowerPoints or with materials that you bring with you to do some teaching outside of the clinical work. And always consider the audience. And again, that's something you want to find out in advance, because you may be talking to medical students, you may be talking to residents, which may or may not be ENT residents, or you may be teaching attendings, and you want to understand and gear your education to that audience and what they really need. And then, of course, there's all to consider the different types of teaching, always a clinic and bedside and an operating room. And then carve out time for lectures, but also, do you want to put on a course, take a day or two to do some cadaver dissections or something like that? And of course, the available resources will have a factor in that too. What do you have as far as AV resources go, or cadavers or equipment? But in any low resource setting, you always have to be prepared for things to not go as planned. And that goes for education and research as well. That your AV equipment may not work, so maybe you're going to end up just giving a talk with no PowerPoint. It may be hard to coordinate with other activities if things get very busy clinically. And then things may change. You may expect to be giving a talk to one audience, and they may say, oh, now there have been times I thought I was just going to be talking to the ENT department. Next thing I knew, it was open to the entire university. So just kind of have to be able to flex with those things. And finally, getting feedback so that when you go back the next time, you know how you can fill in gaps and do things a little bit better each time. As far as research goes, again, preparation is key. Of course, you have to get the appropriate approvals, and that takes a lot of time before you go, but also just understanding what the needs are, and making sure that you're doing research projects that are going to be of value, not just something that's a personal value, but a value to the host country and to the community. Of course, if you can get funding, that's excellent. There's venues for that, but that takes time as well. And then I found that it's extremely helpful to have certain team members that their primary goal is to be working on the research project, because it's always so easy to get so busy with clinic and with the operating room that if you don't have dedicated time and team members, it can be very difficult to do research. And finally, it's never too soon to collect surgical data. I have a picture there of the American College of Surgeons surgeon-specific registry. So you can easily input on that app information about patients that you can be using for future projects. It is important, just like we have to get IRB approvals here in the US, and you may also need to get that from your institution at home, but definitely also check into your host country's requirements, because you can really get yourself into big trouble, not just on a local level at the host, but also even with international law. So be very careful and ethical in that respect. Try not to overburden host systems, a lot of times barely managing clinically, and then you're bringing in research projects. So try to bring in as many resources as you can to not be a burden. And again, this research I find would be extremely difficult to do in a single trip, or going to a different place each year. So if you partner with somebody and work throughout the year, they can make you aware of any local requirements or any barriers that you're going to have to the project you wish to do. But you also help them out with their career aspirations, because, for instance, in my situation, I work with otolaryngologists, and they have career aspirations just like we do. They want to get promoted. They need to publish research. So we want to do what we can to help out with their careers as well. And finally, they can really help with engaging the local support staff, because they're there on the ground and work with the clinic staff, et cetera, every day. I've already mentioned considering the host needs and priorities, but also, like I said, the community needs, and your host can help you with that. But even going back to the different same place over and over, you start to really understand what the community needs are. Communication is absolutely critical in every aspect of life, but most certainly in situations where you're going to be doing any research overseas or any education overseas, to maintain contact with your host. And again, I can't overemphasize involving the host and having a more peer-to-peer kind of relationship rather than, you know, I'm going to come in and I know everything and I'm going to teach you what I know, but really make it a bi-directional relationship. And again, longitudinal, going back to the same place, building sustainability, strengthening the healthcare system. Again, going back to some of the concepts that Dr. Bradford talked about. I don't have much time left, so I'm going to breeze this really quickly just to give a little background. A very successful model is the one that I work through called AMPATH, which is Academic Model for Providing Access to Healthcare, and it's an over 30-year partnership between two universities initially, and then now multiple North American universities led by Indiana University, where I used to be on faculty. And it continues to grow. It has weathered the HIV crisis, is weathering the pandemic. But the tenet is to lead with care, which is what we've done in the otolaryngology arena as well. We started mainly with patient care, building partnerships. It's a picture of me with Dr. Nguitsi, who's my main contact guy there. And then teaching. The third picture is when I brought the flexible laryngoscopes for the first time, and kind of take for granted what it's like to teach residents who are accustomed to it, but these guys were learning for the first time, and it was challenging, but now it's so rewarding to go back and see them using it all the time. And then finally, we added on the research component, and this is the first paper that we published. Arya Jafari was on his research year at University of California in San Diego and reached out to me through a network through the academy, called me out of the blue and said, hey, I've heard your name through the academy that you might be able to support me if I want to do some overseas research. And now we've done a number of projects and publications together, and he's on faculty in Seattle. So it's been a really fun partnership with him, but also very productive. And that's a picture of Arya working with a medical student, David Campbell, who is now getting ready to start his fellowship in head and neck surgery. He's very interested in the global work too, but having this to him, you can see the piles of paperwork. So while we're all in the operating room, they're up in the clinic working on these charts. And really, like I said, it was very important to have dedicated members working on that. And that is all I have. And I just want to say thank you again to the people who put this together and to all the other speakers. It's been a fantastic morning already. And very much thanks to the Academy for allowing me to be a part of this.
Thank you so much, Dr. Cordes. That was a great talk. I really appreciate your time and efforts and all you've done over the last number of years. There was a question in the chat that has been answered by a number of our faculty about publishing as an international individual in one of the otolaryngology or other journals here in the United States. And so Dr. Zafaro had mentioned, just to put this on the video, that the American Academy of Otolaryngology Head and Neck Surgery will be hosting courses for international residents on this topic free of charge. And so to stay tuned for the AAO-HNS and the OTO-HNS journal website for more details. And I don't know if you have any comments on that as well.
No, I mean, I think that that's an excellent resource. And I mean, just the topic of research in a low resource setting is something that is a topic in and of itself. And it's very important, like I said, because you do have to be so careful to follow all of the appropriate protocols and make sure that you're not both ethically and just from an international or the country that you're going to law standpoint, creating any violations that could truly be devastating to your efforts overseas. So I would just encourage a lot of research into those aspects of the project prior to even considering, you know, some more of the brass tacks of the project itself, but just making sure you're going to have all the correct resources to make sure you're doing it in a safe and ethical way.
Great, thank you.